I'm Luke Storey. For the past 22 years, I've been relentlessly committed to my deepest passion, designing the ultimate lifestyle based on the most powerful principles of spirituality, health, psychology, and personal development. The Lifestylist Podcast is a show dedicated to sharing my discoveries and the experts behind them with you. So Dr. Marcella Madera, how's it going?
Great.
I'm so excited to have this chat with you.
Me
After doing the Aqua Method with you at Austin Integrative Spine. It's been, I think, about a month since we did our deep dive procedure. And there's been so many things I wanted to speak to you about since then and just reflect upon. You know, it was a 4-day experience and so much happened. I mean, and then, you know, all kinds of things that I've been doing in my homework afterward, but the actual like going to the clinic, doing the procedure, it was kind of a whirlwind. Everything just like there's so much happening at once. Because there's so many different practitioners and their different areas of expertise working on my case at the same time. And every day is like so full of activities and treatments. It was kind of a whirlwind. And so I've been integrating that for the past month. Wonderful. And as I knew you were coming today, I was like, oh man, this is going to be so fun to unpack this and kind of rewind and give myself an opportunity to more fully integrate some of the things I missed because we were just immersed in the thing. So I'm looking forward to talking about that. And I also want to report, I feel amazing in my body right now. Like even just sitting like this, sitting in lotus Indian style, normally would be very uncomfortable after just a few minutes. Like in my right hip, I would be not having it. And I feel just super settled in my body. So thank you very much.
Thank you. Yay. End of interview.
So just do her thing, you guys. But I mean, I've done a lot of stuff and some of it has incrementally helped. And I'm sure there's procedures that I've participated in that provided help that I wasn't really aware of. And in some cases, you don't know if you would have been worse off down the road had you not done something. But it's rare that I participate in something that is quantifiable so obviously and immediately afterwards. So here I sit as a success case. So I'm going to definitely talk to you about that.
Wonderful.
But since I just jumped into your clinic and your protocol, I didn't really get a lot of your backstory, but based on the diagnostic process and just being under your care during that time, I sense that you have, a legit pedigree of Western medicine and all that behind you before you went into the integrative stuff. So give us a little bit of your history, education, past practice, and what brought you into the more integrative approach.
Yes. Well, first, thank you for the opportunity to be on your podcast. I'm just thrilled to be here with you and thrilled to have had the opportunity to care for you and my whole team. We just had the best time working with you. So thank you. So my journey started in conventional medicine. I went to college at WashU in St. Louis, Washington University, and then 4 years, and then 4 years of medical school, University of Oklahoma. And then I got accepted to medical school between college and med school. I took a year off in between to work in a lab for a bit. Medical school in Oklahoma, then 6 years of residency in neurological surgery at Mayfield Clinic and in Cincinnati, University of Cincinnati. And then 1 year of fellowship and faculty instructorship at Johns Hopkins University Medical School in Baltimore. So, and then immediately after fellowship, instructorship, which is a combination job where you are learning complex spine surgery and you're also a faculty person. So I had my own clinic, my own clinical experience there, which was magnificent. In your words, in the pedigree state of conventional neurosurgical training. And then went from there into Austin and was in a private practice, a conventional medical neurosurgical practice for 10 years with wonderful humans at Austin Brain and Spine, my partners there. And then through that 10 years, at the beginning of a neurosurgical career, it's really getting your feet wet, learning again how to do everything surgically from a attending point of view, from a person in charge point of view, and not learning anymore, but actually being in charge of everything. And so that was about my first 5 years. And within that period of time, I was getting better and better at who I was as a surgeon, but I also kept having the experience over and over that there had to be more to this, because I would see a patient and do a surgery and fix their problem, and the images were perfect. And then they might come back a year later with the same problem, but the images were still perfect and their problem had come back and it didn't make any sense. Or I would fix them with surgery and then they would come back and the next level above or below in the spine would have a problem. Or they would come to me with some terrible arm pain, for example, and their images were totally pristine, like nothing surgical. And nobody had any solutions for these people. And so there's some really, really great things that conventional surgery is great for, but there were a lot of things that I kept seeing that I didn't have a fix for these people, and I really wanted to do more. And at the same time, I was having these experiences over and over as I'm growing in my career. On a personal note, for myself and for my own personal growth, I started studying energy for success, and with Dr. Barry Morgan, who I know you've had on here before, and doing my own practices every day and growing in what I was able to achieve, getting better at my surgeries, having less anxiety for myself, learning about functional and integrative medicine, just learning about all other types of things out there beyond conventional medicine. I thought, I can do this better. I can do this neurosurgery thing better. And I also, in that chunk of time where I'm exploring, I met some really great, ultimately turned out to be great friends and colleagues in the regenerative medicine world and stem cell world, and created my integrative practice to be the best of all of these things put together. So the best of conventional medicine, the best of alternative medicine, the best of integrative medicine, the best of regenerative medicine. And I started my integrative practice, Austin Integrative Spine, as a side gig toward the end of my conventional neurosurgical career for a couple of years. And then I went completely solo in 2020, right before COVID, actually, which was awesome from a business standpoint.
So you signed a massive lease and then no one wants to leave their house.
Yeah, it was great. But actually, it was amazing because even through COVID, people still, in fact, more than ever, people needed that multi-dimensional approach. So not only do I give opinions on brain and spine issues from a conventional standpoint, I have a very extensive mind-body piece and a very extensive integrative and functional medicine piece. And people needed that the same, if not more, during COVID. So it was just, maneuvering the business side, but it was.
Wow. Well, I'm glad, for my sake, I'm glad you pulled through.
Yeah.
I'm glad you were open by the time I met you.
Yes.
So forgive my ignorance here, but I've interviewed at least one neurosurgeon, Dr. Jack Cruz, a few times. And he, I think, only does brain surgery. As a neurosurgeon, do some of you do spine and others brain and some both? How does that work?
There's a wide variety. Many folks that end up in academic institutions will specialize and do only brain or only spine or mostly brain or mostly spine. But even within brain, there are cerebrovascular blood vessel specialists, there are tumor specialists, within spine, there are trauma spine specialists, there are degenerative spine specialists. So there are functional neurosurgery, which is completely different than functional medicine. Functional neurosurgery deals with movement disorders and pain, for example. So within neurosurgery, there are a myriad of options, and based on what you love and what additional fellowship training you want to do, you could specialize or you could do everything. So when I went into private practice early in my career, I did everything. I did aneurysms, I did brain tumors, I did spine, because private practice, that was what we did. So
wow.
Yeah.
So you've sawed open people's skulls and gone in and toyed around with their brains.
I mean, I wouldn't call it toying around. I would call it
bad way to phrase it.
Healing them, but yes.
Well, the way I look at it, I'm just thinking like the doctor game,
Yeah,
game
right.
where it's like,
The operation,
Operation, operation, So
Yeah.
I'm not diminishing the skill
No, it's all
required,
good.
but I just think about, I don't know, it's just always been fascinating to me. And I asked Dr. Cruz about this. I'm just like, for a layperson, just the pressure, I'm assuming, of having someone's life in your hands, one misstep. I mean, especially, I'm sure with the spine too, but with the brain, it's like, there's no like, oops, scalpel hit the wrong lobe or whatever,
You're
right?
done.
I mean,
Yeah.
it's like,
I can tell you.
it's hard to imagine just, I mean, the gore part of it with all medicine to me is a whole other part of just I don't like seeing blood and exposed organs, and it's just, too many horror movies when I was a kid, probably. I got sensitized in a negative sense for that, but I just think it would be so nerve-wracking, no pun intended.
I will say in my early training from the very, very beginning, first in medical school when I decided I was going to be a neurosurgeon, and then early in my training when I saw some of the more complex cranial cases where you actually get to look at the base of the brain and you see the circle of Willis's beautiful blood vessels at the base of the brain, and you dissect you're under a microscope, and it is a, whatever word you want to use, it is a holy experience to be looking at what is the seat of the soul. I mean, that's what it feels like. It's you don't even think that consciously. There is a feeling, there's a vibration to looking at that. And I felt it very early on with seeing the brainstem and seeing the blood vessels. So I knew I was in the right place because I was getting that vibe of like, I'm supposed to be here. This is incredible. I can't even talk about it. That's how profound it is. And so that was a very early experience. And then taking that forward, all the rest of it is just sort of, it's just awesome.
When you were or are currently doing those surgical procedures, what do you do to prep your state? Is there any state change or any kind of mindset or mindfulness practice that you have to go in and achieve the level of presence that's required to be successful?
Well, that's what was so incredible about my early career when I started doing, before I was doing the Energy for Success stuff, what you learn in school is you show up and you're in the zone and you sleep, but sometimes you don't even sleep. In training, sleep is plus minus. And even when you're in practice and you're very busy on call, sleep can be plus minus. So you can't, it's not like the self-care world where, everybody's getting optimal sleep. Like you show up and you do the work and you're trained. You have a training that supports you to be able to bring it when you need to bring it. So before I was doing energy work, it was this sort of like almost militaristic, like when you're on and you're going to get it done because you're trained to do that. You know how to do it and you can bring it when you need to bring it. But once I started doing the energy work, I would actually do my Energy for Success practices like before I start the surgery, in the hallway, before I would go into the OR. And I got to a point where I would have my whole team. I've talked about this on other podcasts. I have a whole team do a practice with me before we started because the whole team got in the zone. So I learned things to get myself even more in the zone and found that I got even more flow state that was additive to my previous training. And I will say now, even though I'm not doing cranial surgery anymore with the laser activated plasma treatments that we are doing for brain disease, I kept the same protocols. So we still do our practices. I still do my own practices before. My team still does a set of practices before. So we're creating this healing environment where everybody's on the same page and in the zone before we start. And what's incredible is now we don't have to do surgery and we still get great results.
So cool. Yeah, I'm thinking back to, and we'll go into some of the details of this, but during that 4 days, the coherence amongst your team was palpable.
Yeah.
There was definitely an energy field that was very different than other medical offices.
Yeah.
And God bless everyone in medicine. They're doing the best they can. But there was, it wasn't just the level of care. It really was like a coherence, like a field. When you go to, a Joe Dispenza intensive or something, and you're in the room for a couple hours, it's like, there's something happening here that you can feel. It's almost tangible, a level of presence and care and devotion, and that was my experience working with you and your team. So that makes sense that everyone's kind of getting into that collective consciousness of healing, and also just people. When you have a team of people that are doing an intensive medical procedure, it seems like it would be important for each member of the team to also just put the rest of their life aside for a moment and really devote all of their attention to the care of the patient, right? Which I'm sure, under a stressful situation kind of happens inherently. Yeah. But it sounds like what you're describing is a much more deliberate way.
From the very beginning, with every team member, part of our onboarding process is this is different. This is not your regular medical office, and we are here to not only provide the medical care, but what you just said, the vibe of being here is very, very, very important, and it's intentional for sure.
Has your HR journey been challenging at all, trying to find people that are medically qualified to come in and, be up to snuff with education and experience, but also to have an understanding of consciousness and to bring in the metaphysical into the physical?
It's a great question. The best answer I can say is from the very beginning, I used my own personal energy for success practices to create criteria of who I wanted to draw toward me, and these people showed up. And all my employees are key employees. I was going to say key, but they're all key. And some of them have come from conventional medicine and followed me. Others I ran across through other pathways in life. And I've had extremely low turnover because of this family holistic vibe that we've created. So,
cool. I mean, thinking about putting myself in that position, I would rather work in your clinic than some stuffy kind of churning out patients by the number.
Right, yeah.
Just monetarily driven, kind of, for lack of a better term, cold clinical environment, where it's like, just come in, what's your name, what's your number? I mean, it's like, many of us have had that experience, right? Where you go see a practitioner that's qualified, well-meaning, but the system itself is not set up to infuse that personal touch and that level of care. I mean, you get a few minutes, there's a short diagnostic, and you need this prescription or this surgery, we'll book it, boom, you're out of there. There's not a lot of warmth and just attention to the whole person. So
we've been very, very intentional from the consult experience, which is where we first learn about you and decide what treatment is going to be a good fit for you and what your goals are and what you want. From that very first consultation all the way to the completed treatment, we're treating you as a whole person. Like, I want to know, what's going to feel like for you to have your hip feel better? Great, your hip's going to feel better. Okay, that's fine. But what does that mean for your life? What will that allow you to do with your day-to-day work, with your kids, with your golf game, with your whatever? It's always a picture of your entire life as a framework for how we're going to tackle the issue.
That's smart, because thinking about manifesting any type of goal, I've found it to be most useful to think about not just to think about, but to embody the feeling of what's on the other side of that goal.
Yes.
So I want $1 million in the bank next week, right? Well, okay, what's that actually going to produce? Well, that's going to produce a feeling of security, a feeling of freedom, whatever it is. So what if I could just elicit the feeling that's on the other side of that now to create the vibrational match for that thing, right?
Yes.
And then whether or not the $1 million shows up or not kind of becomes irrelevant, because I've already created what I thought that was going to bring me ahead of it actualizing.
Yes, and that's exactly what we do as you experienced with the goal session.
Because there's a lot of, anyway, we'll get into the Aqua Method stuff. I have some more things I want to talk to you about before we get into that. So are you still doing traditional surgeries now at this point?
Yes. There are some things that surgery is the most right thing to do.
Okay.
And for very severe, for example, spinal cord compression in the neck, for very severe nerve compression in the lumbar spine, I do still do surgery for those things. Whenever I have a conversation with a patient, it's very individualized, because some patients show up and they are just, I refuse to have surgery, will not do surgery. What other options are there? And I have a very clear conversation that you have a surgical indication, and in conventional medicine, surgery is indicated. These are the risks if you don't right now. We can always do it later, and these are some other options we could do. I would say most of the time when I have that conversation, if it's a non-urgent kind of a thing, most people will try the non-surgical thing. And many times, as successfully, we don't have to do surgery. But it's very, very careful and particular about how we frame those conversations, because you want to be very clear that if you have a surgical problem, conventional medicine says surgery, but there are a lot of other great options.
Okay, cool. Yeah, it reminds me, the other day, I had a direct message from someone, I think it was like on a Thursday or Friday, and she said, hey, I'm scheduled to go in for spine surgery on Tuesday, and I'm really nervous. Do you know of any other things? And I was like, call Dr. Madera's office, like
thank you.
postpone it. I don't know, right? Like I'm
Yeah.
not equipped to advise on that, but I was like, I think you should get a second opinion before you just, because she obviously, like, her intuition was like, I don't know if this is the right thing. I don't know if she reached out to you guys or not, but for me, because going back, so many years I've had nagging back pain, but when I first started to have this experience, I was in the entertainment industry in Hollywood, so I had really good insurance. Whenever I had to go to the doctor, I would just look for the Beverly Hills zip code, and I would just go to one of them. So I went to this fancy, I don't know what, orthopedic surgeon or something, right, on what's that road, Wilshire Boulevard, in the middle of Beverly Hills. And like, he has to know what he's talking about. I went in and, I think they sent me out for an MRI, and he's just like, without even thinking about it, I was like, oh yeah, we'll just do the surgery. We're going to fuse your discs or whatever. I don't remember what the thing was. And I just intuitively, I thought, my insurance is going to cover it. I could totally do it. But I'm just like, what if there's another way that doesn't involve permanently altering the structure that God created my body to have? And I'm so glad that I had the intuition, but think about how many zillions of people out there just go to the doctor and think, well, the doctor's the authority. They have the stethoscope and the lab coat, and whatever they say is the truth, and so many of us have outsourced our discernment and our power and intuition to the establishment. And so I get messages like that sometimes, and I'm like, just explore all your options.
Totally. Well, and I would say, this is probably funny for a regular conventional neurosurgeon to say, I love giving second opinions. That's one of the things that I do in my practice, because that same experience that you're having, that you had, which is an MRI that shows some stuff, but a physical exam and imaging that don't necessarily match, that is more often the case than not. And one of my key things, if you watch any of the content on my website, is that your doctor truly does not know what is wrong with you. Truly. Like, where is your pain coming from? We don't know. We are taking our best educated guess, and that's part of the Aqua Method, why I changed the whole way I do diagnostics now for spine issues. And that experience of having an image and having a pain and the surgeon recommending something, there are so many different ways to skin that cat. And that's why when I do a second opinion, I almost always, the first opinion they got is totally valid in conventional medicine. It's totally valid. But what if you did it minimally invasive? But what if you did it from a side approach instead of a lateral approach instead of an anterior approach? What if you did it front back to have more stability? What if you didn't do it at all and you did something in the regenerative or cell biologic medicine side? So there are so many approaches that having an expert who's been through all of the stuff look at it and give you some guidance and just distill the data and actually spend time with you. That's why I love it so much, because I love spending time with patients and explaining all the stuff that took me 20 years of training and career to learn, which you will not get from your doctor in your 15 to 30 minute, surgical consultation. You will not get it.
I've noticed. Well, when we started on the Aqua Method journey, one of the things, because I like to learn, obviously, like I have these conversations, it's what I do for a living. So I'm just a person who likes the finer detail, and I want things explained thoroughly. And I also want to be heard when I have questions or concerns. And the intake and diagnostic process that I went through with you, I think, was more thorough in and of itself than some complete procedures I've had in the past, front to back. You know what I'm saying? It's like, wow, we get the MRI, we sit down and talk about it for an hour, we look at every little nuance of it. I mean, the whole thing, the nutrition intake, looking at the labs, a couple of long Zoom calls. I'm like, this is how you do this shit. This is the right way, if there is a right way. Because I'm able to make, as a client, I'm able to make informed decisions and have a very thorough understanding of what I'm working with, like what the various stimuli for the pain could be. And as you said, what's really frustrating, I think, for people that are dealing with disc, spine issues, et cetera, is that, and this was the case that I described going to that orthopedic surgeon. He looked at my MRI and he's like, oh yeah, you have a couple of compressed discs, so we're gonna go in there and juice those up and put whatever in there and fatten those up because it's aggravating the nerves. And I was like, well, have you seen worse than this? He's like, oh, many people have way worse spines than you, and they have zero pain ever in their whole life. And some people have less than you and have more pain.
So he's telling you the same thing I'm telling you, except he doesn't want to operate on you.
What the, just like, what is happening here?
Nobody knows.
So because of, many experiences like that, I liked that we went so deep into the diagnostic. And then another thing that was really cool is that I've intuited for years that the lower back pain that I've been nagged by for so long is not actually a problem with my back. I know that I have a very limited range of motion in my hip. I know that I injured my hip some 30 years ago being a drunk idiot on a hike. And I've always sensed that it's not actually a back problem, it's a hip problem. And that when the hip can't move, it steals motion from my back. And I just know that somehow. And no medical doctor has ever been able to corroborate that. And very quickly, on your own accord, looking at the imaging, you came to that same understanding. I was like, yes, finally, my intuition and what I'm sensing in my body is actually being listened to and corroborated by someone who knows how to read an MRI.
Yes.
And that part, that was like a really important part of the diagnostic process for me. And also just helped with my trust and compliance during the process. I was like, okay, cool. She gets it. Finally, someone, that has the medical understanding and experience can corroborate what my subjective physical experience is.
I'm always telling my patients, you and your body are way smarter than I am. Way. You have so much more experience. You are in your body every day from birth. You know when something's off. And that's like the simplest thing of what we do in that consultation part, and also the part where our other team members are when we're evaluating in a group, is that we are getting data from the patient and we're taking the time to do it. Which, I know in my old conventional practice, I actually, I won't say I got in trouble, but I was a little bit eye-rolled about how much time I wanted to block off on my schedule for my new patients, because I needed all that time. I could really talk to these people and figure out what's going on, because they would tell me the answer.
Well, also, I think when you take that time too, because we were looking at labs, we were talking about diet and lifestyle. It's very uncommon that you go see any specialist and they start asking you what your diet is like. You know what I'm saying? I'm imagining, I have a pretty clean lifestyle and good diet and all that, but I might have come to someone like you or another surgeon, and maybe I'm eating a totally inflammatory diet and I live on canola oil and gluten and glyphosate, and I come in and you're looking at my imaging going, oh yeah, we just definitely need to do surgery. When I might have been able to avoid that just by cleaning up my diet and reducing the level of inflammation and thus the pain.
Totally. And early in my integrative practice iterations, one of the first things I did was tell everyone about anti-inflammatory eating. Very simple. I'm a big proponent of Whole30 and as a good starting point for lots of people. It's accessible. For example, there's lots of other great ones. We love Bulletproof. We love lots of diets. But that basic anti-inflammatory diet education plus movement will, in my early phases where people were coming with, I had more, I would say more people wanting surgical opinions, we would do that. And about 30% of the time, their symptoms would go away. Just exactly what you're saying. It's about with cleaning up diet and cleaning up lifestyle and adding some mind-body stuff, many times their symptoms would be gone.
Despite them still having
despite the horrible images. Totally.
That's crazy.
And then once we added the more deep mind-body stuff, that number went up. So the whole decoding thing, when we talk about that piece is it's just another piece of the puzzle of, again, the imaging not matching the symptoms.
Well, let's talk about the Aqua Method, which I think is the crown jewel of your work and what you seem most excited about, and what I have the most direct experience with. So I'm trying to go back and remember kind of what happened. So there was the diagnostic part of it, which included the imaging and some of the meetings that we had beforehand about lifestyle and things like that. But there was overall much more of a mind, body, spirit approach to it. And so part of that was the laser activated PRP. I don't know if I'm calling that the right thing.
Yes.
Let's start here, okay? Because I just got this off your website and didn't realize that this is what we're doing. The 4 R's: reveal, restore, revitalize. What was the last one? Revel?
Revel.
Okay.
Yeah.
Let's start there, and then I want to go into some of the details of what this process involves, because I think it's just amazing, and I want to share it with people.
Yeah. So we built the 4 R's as a way to explain the process. The reveal the first R, the reveal process is really the thing I said before, which is your doctor doesn't know what's wrong with you. Where this came from was my own personal experience of having a nagging. And I every time I say this, I laugh because my patients say stuff like this to me all the time. And then I became my patient, which is I had a buzz in my shoulder. Like, what is this buzz in my shoulder? For years, I had it. I saw a PM&R, physical medicine and rehab doctor. He didn't know what it was. I saw one of the top regenerative injection specialists and injected some very expensive stuff in it under ultrasound guidance with like one of the top people in the world that does that. That didn't make it go away. I did some physical therapy. That didn't make it go away. I did lots of yoga. That didn't make it away. And it was just always there off and on. So this reveal thing came because I had an experience with who is now our functional tissue mobilization chiropractor, Dr. Joey Matina. I had a session with him, and he immediately knew what it was. It had to do with the attachment between my thoracic spine and my shoulder blade, and it was both anterior and posterior components. And he worked on me briefly once, and then a few times, like maybe once a month after that, and it went away. I mean, and then in addition to working with him, he said, "Oh, I have this amazing trainer. He can give you some exercises to do." And so I started working with Matt Lindemood, who gave me very specific stabilization exercises specific for that, but also for my whole body. And I'd been working with him for at least a year before I kind of put this together for patients. But the end of the story is that the reveal of figuring out what is wrong with you, it is not just the doctor, the orthopedic surgeon, the PM&R doctor. It is a doctor or a person who understands the medical piece, plus somebody who understands how the whole body fits together. And that's what Dr. Matina's expertise is. And he does this thing, functional tissue mobilization, which has to do with releasing the tissues such that you can get the inflammation out and get blood flow in, and he resets your body. It's not like conventional chiropractic manipulation. So reveal is somebody who, the medical person looking at the medical history and the medical imaging, the tissue worker who knows how your tissues work together in your body, and not just one body part, by the way, all the adjacent body parts that are working together. And then a movement specialist, and that's Matt Lindemood, our trainer, who can look at your body as a whole, how it moves, and see, oh, you've got that pattern because of that injury. So now once we clear this out and get the tissue working better, then we repattern the movement to get your whole body working together as a whole. So that's a very long way of saying that the reveal process is looking at you from multiple different angles and then developing a treatment plan in real time on your body live. And that's
the multifaceted diagnostic.
Yes.
Yeah.
And it came from my own experience of nobody knowing how to fix me. And then I found these people and I was like, oh my gosh, you guys are incredible.
Well, I think that's
Let's fix people together.
That's one of the things that drew me to your work, because I've had a lot of stem cells, PRP and exosomes and all that stuff. And like I was saying before, who knows how much worse my case would be had I never done that.
Sure, yeah.
And I'm sure it's all been helpful. And in some cases, it has been noticeably helpful. But one thing that's always kind of baffled me is that none of those practitioners have included any kind of movement into it, Because I go see the movement people, the functional movement people, the ancestral people.
And they're not talking to the people who are doing your
And they're like, dude, you
Yeah.
can go shoot all the shit you want into your knee or elbow or wherever, and if you're not repatterning the ways that you move, like, you're not going to get the result, right?
Yep.
And then the medical people are like, well, you can go move all you want. You have arthritis in this joint and we need to get some fluid in there and get it healed, So it's like, I found there's all these kind of very qualified and legitimate experts in their siloed areas of expertise that aren't crossing their wires and integrating. I think that was a really interesting part of what you do is you have this team of all these different people that are approaching that, especially, well, not especially, but not only in the diagnostic process, but also in the actual procedure and in the aftercare.
Yes,
okay,
exactly.
So that's reveal, then restore.
So restore and revitalize, I'm going to lump together to explain this 3-day process of a multi-layered system where we're reprogramming the nervous system from the ground up. So restore and revitalize is what we're doing for starting at the base, the molecules and cells. We do a laser activated plasma procedure, which is a simple IV. Blood is drawn, spun down. We shine a very particular laser through that to activate the plasma. And then we re-inject that through the IV. At the same time that we are re-injecting and passing that same laser over your body, at the same time you're getting that infusion of the activated plasma, we are also doing functional tissue mobilization, which is this deep tissue work that Dr. Matina does. And you may remember that is very intense. And what we're doing is forcing out the inflammatory fluid and resetting the tissue with deep tissue work, but it's not deep tissue massage. It's very specific. There's actually really good peer-reviewed data on when you do this very specific functional tissue, you're able to reset the tissue so that then it's able to perform better afterwards and is able to feel better afterwards. So at the same time we're giving the laser activated plasma, we're resetting the tissue. That's the next layer up. And then an additional layer that's interwoven with that is the biologic decoding, which is a conversation between myself and the patient, and some of the team members participate as well. And we're looking at the psychological and life circumstance roots of the problem.
Awesome.
And I'll pause on that and see what
That's
you
good.
remember.
Yeah, no, because
it's a lot at once.
Yeah, I want to dig into that because that's something about this experience that was really interesting. Okay, I've put some of the pieces together, right? Like, oh, I had a physical injury in my hip years ago, right? And then because of the work that I've done on myself and shadow work and emotional trauma healing and things like this, I've had insights into, especially that my problem is in the pelvic area. And when I was a kid, I experienced sexual abuse. And you don't have to be a rocket scientist to figure out that there could be a correlation between issues around your pelvis and you being violated, right?
Right, yeah.
And so, I've done a lot of healing work around that, and I don't know that it's ever something you're totally done healing, right? It's a pretty profound injury and psychologically. But what was interesting is doing that biological, what do you call it?
Biological decoding.
Yeah. I don't have all the names down and stuff. There was a lot happening in a few days, so forgive me.
Yeah.
But when we were doing the procedure and getting the injections and that work is being done and the whole room is praying and my goals and affirmations are being read out loud, I mean, I had really profound emotional healing at the same time, akin to something that I would experience in therapy or even in a plant medicine ceremony or something of that nature. And I'm laying there going like, what the fuck? And just having the kind of, just the vulnerability of it for me. I mean, had I not felt the level of trust with your team and the emotional safety of that container, I don't know that I would have been able to be that vulnerable. Time that in a medical, well, not maybe, I think it really was the first time in a medical setting involving lasers and injections and a legitimate doctor, a surgeon, a neurosurgeon, and I'm having this emotional healing and really being held in a beautiful way by your team. And I remember laying there just going, this is it. Like, this is what people need, at least people that, have something that they've been stuck with, that they haven't been able to fully overcome. So that, I think just especially for me, the emotional and spiritual components of it and really acknowledging that in the process of the procedure was really powerful for me. Because I know, there's a purely physical component, but there's definitely a psychological and maybe even karmic and spiritual part of it too. So my question is, when I was crying and having kind of this emotional cathartic experience, is that common? Was the way I was responding kind of the way it goes most of the time, or was I different in any way?
One of the things I'm most proud of for myself and my team is our consistency in producing success with this process, because I love the way you put it, of all the things we put in the container. So in a short period of time to describe all the things we're doing, I think container is a great word, because I mentioned the laser activated plasma. I mentioned the deep functional tissue mobilization. Immediately after that session, there's also physical training. There is the activation of the cells, which I didn't mention before, which during the laser shining through the plasma, once it's been prepared after we get it out of you, we are reading your goals aloud. So that the whole room is in the vibration. All the people that are taking care of you are getting the vibration of what we're trying to create. The same thing you mentioned earlier about, creating, you want to envision the future and then you match the vibration. So to answer your question, does this happen every time? Yeah.
Really?
Yeah. And we've had massive emotional releases. We've had people tell us things that they haven't told anybody. And it's because nobody's doing this. Nobody's connecting things that happen in your life. It could be remote life. And some of it is transgenerational too. And you may not even know it, but just letting your body hear that may or may not be your stuff. And that's okay. And we're just going to talk through it and then we're going to release it. That process, when people come ready for the experience, it happens that way every time. And I would say, because of the investment that this experience is, people come ready to work. Because if you're going to, work in a way that of allowing the body to do what it needs to do to heal. So the other thing I was going to say is that this idea of connecting things that happened to you in your past to current pains and disease, I used to think it was kind of interesting. And now we've reproduced it over and over and over. There is always something that comes out in these sessions, always. And it doesn't matter if it matches perfectly what the book says. There are books about this, because it's whatever that person is experiencing in your body. Your body is a whole person. All your molecules are connected. All those vibrations are connected, and they're carrying things that came, from your life and before, and these painful experiences we've all had. So whatever comes out in that session is going to be healing for your body. And I think that's part of why this works so well. Yes, the laser is wonderful. Yes, the plasma is wonderful. Yes, the deep tissue work is wonderful. And yes, the training is wonderful. But because we're offering such a bunch of healing in the container, it just elevates the healing for all of it.
Yeah, well, I'm glad to hear that your staff is used to someone losing their shit
every time. Every time. That's a success for us.
Like in a situation like that, one is often faced with self-consciousness that can come up.
Sure.
It's like I'm talking about deeply personable, vulnerable stuff and what's coming up, and I'm crying. And sometimes I'd open my eyes and go, I don't even know these people. You know what I'm saying? It's like, just trust, Luke, you're safe.
I always just tell people, this is why you're here. Like, you ended up on this table in this for a reason. So.
Yeah, well, I'm relieved to hear that I wasn't
You're not
more
alone.
Of a basket case than anyone else.
You're not
but,
alone.
I don't know. It just, like I said, it was actually involuntary. The emotional depth that I was taken to. It wasn't like I decided, ooh, I'm going to get into the nooks and crannies of my trauma. It's just like, oh shit, I think my body was really kind of speaking to me and saying, hey, we're here too. We were part of those experiences. It wasn't just psychological, emotional, mental. It's like the body remembers
totally,
just like it remembers physical injuries, right? It remembers emotional injuries and insults as well. So that was really powerful. And I remember just being like, oh yeah, this is it. There's something happening here that hasn't happened before.
Yes. Yes.
Tell us a little more about the laser activated PRP. What makes that laser different than other, cold lasers on the market? I've worked with lasers a lot.
Yes.
I have one here, it's called a Power Medic laser, and I've used it for a lot of things, and it's useful. And I've had some more hardcore lasers from practitioners that aren't
Yes.
like home use models. This one is much different, I think, in its level of sophistication. What can you tell us about how that plays into the treatment?
Yes, so this is Dr. Todd Avokaitis is the inventor of this laser, and it's called the Key Laser, QI, or I think they actually changed the name recently. But it is only available to licensees of his protocol, so it's for physicians, other care providers that he's licensed to. And there are only about 15 in the world that have it right now. It is a red light. The light is not what is distinguishing about it. It's 670 nanometer light, but the optics behind the light actually create a different shape of the wave so that the wave itself is able to deliver photons deeper than just the typical red light surface. When Dr. Todd was working with this laser originally, he had some landmark discoveries in the lab, and then has a couple of papers talking about the ability of this laser to activate cells within plasma. That is part of what I think is likely special about this laser. I also think that vibrationally aligning the plasma that includes, yes, some cells, but also other growth factors and molecules. People have been studying laser activated plasma for a long time and already proven elsewhere that it's effective. So this is an advancement beyond other types of laser activated plasma. I think when I talk to patients about this, the best way to think of this is that we know that light has incredible power for healing. And this is a new, different way of harnessing that same technology. But it definitely is different than other lasers that you can buy as a consumer. It's a specific for these treatments.
Dr. Todd, I think we met at Paleo Effects a few years ago, you and I. I don't remember if I met you or Dr. Todd before, but I met him at my friend Daniel Raphael's house. Mm-hmm. And he was there doing kind of a salon and explaining his technology to people. Yes. And I couldn't afford his treatment at the time, but he did a little laser action on me, and he's just so brilliant. He's just such a knowledgeable guy, just a wild guy. So he's explaining the way the laser works. And I'm like, it's just going way over my head. I had no idea what he was talking about. But one thing I do remember is he said, he was like working on my eyes, and he said, as I shine this on the side of your temple, this laser is going all the way through your head and in the wall across the room. Yes. I was like, that's interesting.
Without burning you, because that's the key. Right. I didn't say that, but that's one of the key distinguishing things is that you're able to get that depth of penetration without the tissue damage because of the internal hologram that he created that is proprietary that changes the shape of the wave.
Okay, interesting. Yeah. So that it got my attention. I was like, one day I'm going to follow up on this.
Yeah.
And I met you, and here we are.
Yeah.
And as I understand it, with what you're doing with the plasma, is the laser acts as kind of a homing
It
device?
Does two things. Yeah. It activates the plasma and makes it more able to do its healing work, number one. And then number two, when you shine the laser where you want the cells to go or where you want that plasma to go, they will go there. And the way that we know that works are based on the clinical results in our patients who have experienced it.
Cool. I found that to be really interesting too, because you're taking the blood out, you're spinning it down, and then hitting it with the laser, then injecting it into your arm in an IV, so it's just going systemic, which is very different than other procedures I've had with biologics, where they're being injected right into the
right. And you can do that with this, but for many things you don't have to.
Okay.
Yeah, and especially when we add Aqua, when we do all our Aqua things, which are the functional tissue mobilization and the training and the mind-body work and the 3-day iteration of these treatments, that is, in my clinical experience, the Aqua Method is as effective as doing injections under anesthesia, which is incredible. It's less invasive. Yeah.
Wow. Yeah, I don't like going under anesthesia.
Nobody does. Yeah.
It's kind of creepy every time. I mean, I've only done it a few times, but every time I'm like, what if I don't come back? I'm not done,
Totally.
Because you're gone. The last time I went to Dr. John Lawrence's clinic down in Florida, and we just did, I think we were using ketamine and nitrous oxide So it wasn't, like anesthesia, but I was totally disassociated and had that feeling. I was like, I don't know where I am, but I'm not in the room anymore. It's not a comfortable feeling.
Yeah. So the last piece is we call it revel because it's a celebration and also a forward motion. Like, not only do we work on you for 3 days on these multiple layers, as I said, so molecular, cellular with the cells and plasma, and then tissue with the tissue work, and then whole body with the training, and then interwoven with the decoding and the mind, body, spirit. All of that is happening, but then we don't just let you, fly away. We celebrate what success is, and we give you a coaching template of how to take all of this stuff forward. Included are 2 sessions with our trainer online, so you get to kind of incorporate those exercises at home, so you know what to do.
Which was very helpful. Matt and I did them on Zoom, and luckily I have a big monitor, and down in the office, I'd move the monitor, and he would basically critique my movements and run me through it, which is really a helpful part of it, because in my experience, I work with someone who's a movement specialist, right? And they show me the things, and then they take some videos on my iPhone, and then I get home and I'm like, wait, what was it? And then I just can't get it down. So doing the couple follow-ups with him was really, really helpful, because then by the time we did the 2, I could memorize them, and then now I can just do them anytime. Like yesterday, I was watching the sunset, and I was like, oh, what am I going to do? I got a few minutes here. I was like, oh, I'll do that one. I don't even know what the move's called, but basically just the glute activation.
I was just going to say glute activation. You got it.
Oh, this is cool. Now that I've integrated that and I know what it is and the purpose of doing it, it motivates me to just kind of just do it ad hoc when I'm just out and about. So anyway, carry on.
So we give you the exercises to do on your own. We give you these 2 sessions with Matt, incredibly gifted on Zoom, so it's very easy to get in your own environment and get set up. And then give you, as I said, a coaching template of what to take forward. Part of that decoding process that we've done in the 3-day container is create mantras that are very specific reversals of the problems that are the psychological life things that contributed to your pain. So if you've had something negative happen in your life that we think might be the root of what is going on with your back pain, we don't focus on what that negative problem is. We focus on the solution. And we give you a mantra for you to take forward, a short sentence. And we build these throughout the week. So over those 3 days, you might have 5 or 10 that you take forward with you. And we give those to you at the end. So again, you have something to celebrate and take forward with you as you're continuing your healing journey.
Yeah, I found that to be very useful too. And I have the recordings too. There were 2 recordings, because I did the biological decoding with Amy, and then you did one with me, which I think was having something to do with the energy for success.
Yes, the guided visualization that was adapted from Dr. Morguelan's Energy for Success that I personalized for your specific situation.
Yeah, because I'm a listener. I like audio.
Yes,
I like putting that on. And just remind, because when you do these kind of procedures, it's very common that even when you just go on any kind of retreat, like you go home and you just get back into the inertia of your life, and you kind of forget that it happened, right? And then some time goes by and you're like, I don't know if that really worked, because there's not really anything to do or integrate afterward that at least in many cases is not concrete.
Right.
So it's like the affirmations, listening to those audios, doing the sessions with Matt, the movement sessions, and then I have like the accountability of my success is now on me too, because if my body starts feeling weird, because this happened a couple times, I'm like, I don't know, my back kind of hurting today. Did that work? And I go, well, have you been doing your exercises?
That's right.
It's like, well, kind of. All right. So it's a partnership kind of approach where I'm just like laying there. Okay, fix me. It's like there are things that I can and hopefully will do to help facilitate that.
Yeah, for sure.
For you guys listening that want to check out the Aqua Method, you can go to lukestorey.com/Aqua Method, and you'll get all the show notes from everything we're talking about today. You can also get $1,000 off by going to energyforsuccess.com/Luke.
The $1,000 off is a separate thing.
Oh, okay. That's if they want to do the Aqua Method.
If they want to do the Aqua Method, they call my office for $1,000 off.
Okay, cool.
And then there's a free guided visualization.
That's what that is. Okay, so energyforsuccess.com/Luke, free guided visualization, which I highly recommend. They're very powerful. And if you just want to get all the information here, lukestorey.com/Aqua Method. Let's talk about the importance of social relationships as it relates to healing.
So it's interesting. We actually had a patient today going through something really challenging with that. So in what frame do you want to talk about?
I mean, say someone's having physical pain and you're diagnosing that, and you as a practitioner are working with them, and they have a lack of cohesion or support in their immediate family, community, friendship group, and are kind of all alone. How important is kind of the emotional connection and support when it comes to healing?
Got it. So I would look at that in two ways, both a chicken and egg kind of a thing, because I have seen patients whose physical pain is a result of the lack of social relationships and support. And so when I'm working with someone and looking at what their total life picture is, that is part of our consultation. That is one of the things we talk about, is what is your support system? And invariably, when people have less social interaction, less things that are bringing them joy. I mean, some people are introverts, right? So it's going to be individualized, but everybody should have, at least 1, 2, 3, 4 very close relationships that are able to give us that oxytocin baseline. That's the love hormone that we all thrive on. That's kind of the whole point of being here. And when you don't have that, either it's going to cause you to have a pain problem or a disease or some kind of medical problem, or if you want to say that they're separate, which I actually don't think they are, I think they're all intertwined, but if you want to say that they're separate, then if you're dealing with trying to heal something, my belief is we are not put on this planet to be alone. And so the more support, the better. But that, in my opinion, also is tempered that if it's, supportive, energetically supportive, because you can certainly have family members and people who say they're supporting when there's more draining that's going on than supporting. And that is very true with people with complex medical disease, that, people that have been through so much. A lot of my patients have been through a lot of complex things or multiple surgeries before with other people, and they still have pain. And that's very, very draining on an individual. It's also very, very draining on a family. So even though the family is trying to support, it might not be a win-win supportive situation. So to answer your question, I think it's highly important and really nuanced.
Yeah. The emotional component I found to be huge when it comes to healing. I just know like there have been times in my life in the past where I was going through a lot of emotional duress, especially in the context of relationships, and it made me physically ill in different ways.
Yeah.
It's crazy. I think nowadays people are starting to connect those two, but we used to have this very, reductionist approach to this, right? Like you go see your psychiatrist for this, your therapist for this, and then your medical doctor for that. And
it's all the same stuff. And that's one of the reasons I started this practice. I remember very clearly a patient who had this horrible leg pain, horrible, and nothing on her images. I mean, nothing. And I started asking about her life, and oh my God, like the story that came from and it's like it was just no question that this difficult life circumstance or difficult relationship or difficult emotional response to whatever is going on, everybody has something. We're all here dealing with all our things. There's no question in my mind that is the root of disease.
Yeah. Going back, I mentioned Joe Dispenza earlier, and I don't know if you're familiar with his work, but I've been to a couple of his workshops and or intensives, I guess he calls them. They're 5-7 days, and I love them. I wish I could go to more. But what's been really interesting is he has a huge medical staff there and scientists and stuff that are doing QEEGs on people and blood work, and they're quantifying the effects of these metaphysical practices, the breathing techniques, the meditations and stuff. And he's got people with chronic diseases, sometimes potentially fatal diseases that are reversing them just from doing this emotional work. And it's crazy. Like, and he gets criticism from people that are, call him pseudoscience or whatever, because he's dealing in the quantum. It's the unseen realms, and you can't quantify it. But you can quantify if someone is sick and then they do this thing for a few months or a couple of years, this practice, and then they're not sick anymore, right? So it's like, call it what you will. But I think it's exciting that more people are becoming open to, like you have, a more comprehensive approach and not ignoring things like your relationships and your emotional health and healing your emotional trauma and all these parts, rather than just trying to go at it from a physical standpoint.
For sure.
So as I said earlier, I'm, within a month out or something, I'm feeling great in my body. I feel like I'm continuing to heal. The more of my homework I do, the better it gets. Days I skip, it's less so. So like I said, it's a fire under my ass. But I was going over to prep my notes, and you guys have had a 70 to 100% improvement in chronic pain patients. I mean, that's pretty staggering. How, from where are you deriving these results?
Yeah, so our response rate at the end of Aqua Method, at the end of the 3 days, we have our 100% response rate, meaning every patient has responded at the end of that 3 days. And then the response rate, the stick rate, is about 90%. So there's a couple of people that have gone through this process that did not maintain their improvements for a multitude of complicated reasons. But part of that has to do with the variability has to do with the complexity of the disease that we started with. And so we have 100% response at the end of 3 days. So everybody gets better by the end of 3 days. And then the reason that it doesn't stick has to do more with what happens after that, and also how complex the disease was to start with. The other key thing is that in our patients that have chronic pain that has not been healed with other modalities, and we're talking all kinds of other modalities, we have a 70 to 100% reduction in pain, meaning wipe it out completely down to wipe it out 70%. So we're basically better than half of wiping out severe chronic pain, which is a separate category than our people with more acute stuff or less complex stuff.
Got it. And what would be some indications for something like the Aqua Method? A lot of people, I get a lot of questions of people, I have a herniated disc or a slipped disc. This seems to be something, I don't know if people really even know what that is. I don't necessarily know. It seems to be like a common thing when people have back pain. They think it's that, or they've been told it's that. What are some indications that would be appropriate for the Aqua Method versus some where you would be like, okay, I got to go back old school and do traditional surgery on this?
Right. So the sweet spot for these treatments are pain in a joint, and I would say the back pain, neck pain, knee pain, hip pain, shoulder pain, arthritic, musculoskeletal stuff. Some people will come with a diagnosis of a slipped disc or a diagnosis of arthritis, but many times what they're coming with is not what we end up saying that we think it is, but that's okay. Because just, anybody with an arthritic or joint or old sports injury or, nagging golf hip or nagging back pain they've had for a long time or even a short time. Within that spectrum of patients that have those things, you have patients who are early or mild, meaning maybe they've had it a few years, but they never had a procedure, they never had surgery, or all the way to people that have had back pain for 20 years and have had 5 surgeries and now have chronic pain after that. And so the people on the more complex side, we can still address. They might be in that closer to 70% improvement or might need multiple treatments to get the result that they're wanting. Or they might do Aqua first and then do injections later to get the next dent in their improvement. But that's a small subset. Those are like the most complex people. The less complex people that have maybe never had surgery before, only had mild stuff before, maybe had some injections before, got better and then got worse again. The sweet spot is musculoskeletal pain. And then we have a whole slew of other things that we do that are separate from Aqua Method for other neurologic disease. And then for one last thing, people with severe spinal cord compression and severe nerve compression, we will have a very clear conversation that there is some risk to waiting to have surgery to see if this could help. We have done it with people who thought they were going to need surgery for their low backs with a large herniated disc, for example, and haven't had to have surgery and have been neurologically stable and improving. I would say that, but that's a narrow subset of people that are like majorly surgical that can get away without surgery. So to answer your question, it's a range, and we dive deep into this in the consultation and get you the right solution.
Then in terms of cost, the Aqua Method at this present time isn't covered by insurance.
Correct.
Right? And I'm assuming that other more traditional surgeries are covered by insurance.
Yeah.
Do you run into issues with potential clients that are like, well, I don't really want to get surgery, but my insurance is going to cover that, and they're not going to cover the Aqua Method, so I'm going to do what the insurance covers?
Yeah, I mean, that's a decision that, everybody comes to that gets a second opinion. Like typically, not typically, but sometimes people will have a surgical recommendation elsewhere and they'll come and see me. And I always say, the medical system is not incentivized to let you heal yourself, which is what this is. And it's not built that way. It's not, there's so many people making so much money off of that surgery and it's not win-win for you. It's going to hurt more. It's going to make you suffer for a couple weeks until you recover. And as a surgeon, I know this for sure. And there are plenty of things that surgery is good for. But if you can avoid it, what is that worth to you? And that's what people have to decide, right? So I would say most of the time when people come and they've been told that they need surgery and they're kind of feeling it out, most of them end up being my patient because they'd rather take a financial risk and then the medical and pain risk of the surgery. If I tell them that I think that this other thing will work. I mean, sometimes, apples to apples, if I say, what, surgery is as good or better than anything else over here, and I'm out of network for surgery, then they might go elsewhere because, surgery is still a good thing. And that happens occasionally.
Right.
Totally cool.
And if someone was paying cash for surgery versus paying cash for the Aqua Method, the Aqua Method is what, like 20% of what surgery would typically cost?
I mean, it depends on how much of the surgery, like if you're completely not covered under insurance and you have to have a lumbar fusion, that's at least 30 to 50 to 100,000, depending on how many levels and where you're doing it,
right,
and what hospital and what part of the country. And the Aqua Method is 25.
Right. I didn't even think about this in terms of other procedures, but I wasn't sore or anything after this. The hardest part about the Aqua Method was the training with Matt. It's like each day, you're doing injections and all this stuff. I'm like, this is the easy part. I'm like, oh shit, after this I gotta work out. With Matt. Yeah. And it was crazy because to anyone who's really fit, the stuff that he was doing is, I mean, it's not like you're lifting heavy weights or something. It's like body weight stuff and just stretching. Yeah. It made me realize like how out of shape I am, because he's like, stand on one leg and just lean forward. I don't know what the move is called. And I'm like, 30 seconds, I'm dying. Exactly. And he's being compassionate and patient with me, but I could kind of see in his face like, dude, this should not be hard. Right. And then, but it has gotten, he's like, trust me, it gets so much easier. And he's right. Yesterday when I was watching the sunset, I was like, oh, I could actually do this for a while. Yeah. And the first day with him, I mean, dude, each day I was smoked, and I was sore after the procedure, after the 3 days, but it wasn't sore from any of the injections or any of the medical stuff. I was just
Your body was
It's
sore.
like my glutes were activated for the first time in 20 years or whatever,
Exactly.
And so when I checked in with him, he's like, how you doing? I'm like, I feel like pretty sore, man. It's like, oh, it's actually it's just muscle soreness, like if you hadn't worked out in a long time. Yeah. But now that you say that, in other, just stem cell treatments and different things I've had, they've been, pretty hardcore and invasive and a lot of swelling and just, can't walk very easily afterward and things like that, So like the medical part of this for me was very easy and virtually no recovery. It was just those damn workouts.
Yeah. Well, and that's the thing people ask, like, I have gotten the question, like, why is it so expensive? And I mean, you think about the trade-offs that you're making. We are teaching you as a bunch of care providers. It's not just me and the patient. It's all of these professionals, like all of these degreed professionals, a bunch of them working on you at once.
Yeah, it's like the Avengers.
And yes, that's a really good comparison. I like that.
I don't know if that's trademarked, but we could come up with some version of that.
The Aqua Avengers. But it's all of this brain power that is delivered to you for then you to learn how to do it yourself. And it's just, you just cannot really compare it to other treatments. That's why I love to do interviews like this to dive deeper into it so people can really understand. Like this, you can't say, okay, I could go down the street and get a bunch of stem cell injections for the same price as I could go and do Aqua Method. They are very, very different. And then you have to decide, and that's why we do this deep dive 2-hour consult with our patients before we sign up for this, because you got to understand, like, what does it mean for you? Am I ready to dig deep into these, life experiences? Am I really ready to heal from that thing that I never told anybody ever? I mean, those are the people that end up choosing this. And oh, by the way, you don't have to have any shots in your body and any swelling.
Yeah. Oh, my PT guy, Alex Rybczynski, who I saw this morning, and my neck is feeling amazing. Thank you, Alex. So I got the new teeth in. It's a whole thing. Yes. Like you walked in, you're like, "How you doing?" I'm like, "Man, I'm working on a lot of stuff. Let me track what we did, which was a month ago."
Yes.
But he wanted me to ask you, in terms of the biologics, or I guess any of the work you're doing, have you ever seen ligaments heal? Like a torn labrum or something actually, become whole again?
Great question. So in a case-by-case, occasional MRI now and an MRI later, I have seen disc improvement and I have seen tissue improvement. Now, was that because of the cell treatment or the biologic treatment? Was it the body healed it itself? Nobody knows. That's why if you look in the literature, there aren't thousands of papers that say you can treat your body with stem cells and then get a new lumbar disc. There's actually only 1 or 2 papers, and they haven't been able to be reproduced as the last time I looked, because in doing these studies, you can't control for what the body is going to do on its own. So to answer your question, my typical answer across the board when patients ask me, is my MRI going to get better? I'm going to say, I do not care. I want you to feel better, because you can have a torn labrum in your hip and have 0 symptoms. You can have a completely wiped out disc on your lumbar spine MRI and have 0 symptoms. It is not about the images. It is not about the images. And I will go to my grave talking about that on TV, because that's one of the key things in surgical training that was ingrained in us, is that, okay, bad image, surgery, fix. And it doesn't have to be that way. That can work. And you have this very severe compressed spinal cord and the person is quadriplegic, and then you decompress their spinal cord and they can move again. That is accurate. But it's not accurate for every single disease, every single imaging abnormality.
All right. Yeah, and I remember when we looked at my hip images, you said there was a little arthritis in there, and that totally freaked me out. And you're like, that's no big deal. Dude, arthritis?
Right.
It's like, I don't even know what arthritis
They're loaded
is.
Words.
Exactly.
Yeah.
But you didn't seem concerned about it, so I was like, all right, then she's not worried about it. I guess I'm not either.
Yeah, because that's another big thing I do in all my second opinion consultations is demystify and escalate the fear about this diagnosis or this imaging finding, or, oh my God, I have this. What does that mean? Like, I don't know what it means. Your other doctors don't know what it means either. Let's get you optimally healthy and see what your body can do on its own. And then maybe we'll add some other cool technology to it and see how your body can take advantage of that. But the diagnosis itself doesn't have to be this big, scary monster.
Right, because
it's all fixable.
Someone could show an arthritic joint on their MRI and have 0 pain.
0.
So it's like, what does that really mean?
Yeah, but it's very personal. When it's you, it's like, oh my gosh, I have this thing. I mean, I totally get it. I have a huge amount of compassion for it. But it's also like, that's what our medical system has done. Make it scary so that they'll go and have the surgery so that we can churn the money. And everybody gets paid, and the insurance companies get paid, and the hospitals get paid, and all the people.
Right, racket. Well, you're doing your part to break that system in a really great way. I want to actually talk about some of the other services that you provide outside of the Aqua Method. That's my only experience of the work, but
yes.
Are you doing the stem cell facials and breast enhancement, sexual optimization, hair rejuvenation. Tell us about all that stuff.
Thank you for that. So we added some cosmetic and anti-aging stuff to our practice, mainly because patients kept asking over and over, can you use this stem cell technology for my whatever, sexual health, hair, face? And so we started doing it. And yes, I learned that from Dr. Todd Ovokaitis and his team. And the thing that I like the best, the thing that we've had the most success, or the two things we have the most success with, are the stem cell facial, which is a microneedling procedure. Then the liquid you use for the microneedling is actually the laser activated plasma. So same stuff. We just paint it on the face after microneedling, and then we'll also laser the face afterwards. It's as effective as about 3 conventional vampire PRP facials. So again, this is the laser plasma. This is more stronger than the PRP that you can get from at most places. And then we can also add exosomes to that if people want. And then we can also do injections for hair. So for the face and hair and male and female rejuvenation, we do have multiple procedures for all of those. They include the laser activated plasma, the same procedure that you had. My favorite is the face rejuvenation that we do with microneedling, and then we also can inject the face with that laser activated plasma, and then also pass the laser over the face as well. So that is about as strong as 3 typical vampire facials that you would get elsewhere, and this actually has activated stem cells, and we can also add exosomes to it. So that's my favorite of all those things. But we do hair rejuvenation, we do male and female sexual optimization, and the face, as I mentioned, yes.
Tell me the deets on the sexual optimization.
Yes.
Years ago, and I did a podcast about it. We'll put it in the show notes for those interested. LukeStorey.com/Aqua Method are the show notes for this. It was with Dr. Harry Adelson and Amy Killen.
Yes.
And I went out to Utah, and they're like, "Well, do you want the whole meal deal?" I'm like,
yes.
So I didn't quite get Amy's part of it. Was penile stem cell injections, and I do it. And I think they did my face, and my spine, and all kinds of stuff. I wasn't having any noticeable problems in that area. So I don't know, like if I would have had ED or something, and then she did that, and then I'm like, I'm rocking and rolling after that. But I got to say, for my age, I could, I'm no spring chicken. I think it probably did have a positive effect. On the sexual enhancement end of it. What kind of, what does that procedure look like in your clinic, and what results have you seen for people doing their private parts?
Yes, so for men, what we do for both men and women is we use that same laser activated plasma that has the activated V cells, very small embryonic-like stem cells, and that laser activated cell fluid is injected into the penis for men, and then for women, we can do IV injection and just laser the female genitalia if they don't want injections, or we can also inject the female genitalia. I'd say for women, it's about 50-50, women wanting injections. For men, I would say most of the men go for injections, because I do think the injections make it a stronger treatment. And for the men, what we've seen is with a post-treatment pumping protocol, we've seen significant change in length and girth.
Really?
Yes.
Well, you just probably got a lot of male customers. Medicine's been trying to crack that code for decades. It's not longer.
Yeah, and we also we do the injections and then laser at the same time, and we also use nitric oxide, so it actually makes it, it still hurts, they say, but it's a much more pleasant or easy to go through procedure when you have the nitrous. And then in men, another consistent result we have seen is morning erection for lots of guys. That's what they report back. So
wow.
Yeah.
That's amazing.
It totally works. Yeah.
I kind of forgot about that, and when I went and did it too. So funny. They hired a video crew, because it was out. I couldn't bring a video person, so they hired someone, and they didn't tell the guy that it was going to be a medical procedure. He thought he was just shooting an interview. And then they're like, "Cool, the interview's over, so set up, and we're going to put Luke under anesthesia." And they do the whole thing, and the poor guy kept passing out. And having to leave the room. There's all this blood.
Oh God.
My junk's out, and bloody, and God knows what. And what's funny is it's on YouTube for anyone that wants to watch it. I've never watched it because it would freak me out to see myself drooling and bloody. But yeah, I put on YouTube, and they never took it down. I mean, I'm sure there was a sheet over whatever. But yeah, there was one of the funniest podcast recordings. They're like, yeah, the poor guy, he kept having to leave the room. He's turning green and just like going out in the hall to take some breaths.
Oh my God.
And then I give the footage to the video editor, just like, who shot this? Who's the amateur that couldn't hold the camera straight? Poor guy's like, just shaking the camera.
Oh my God.
Oh, that's funny. Okay, so men are having that morning wood.
Oh, and then women results, I would say, are more arousal and general feeling of wellness. And I will say that this particular technology seems to be, for the women, you don't need the injections to make it work. And the injections, as I said before, I may have said before, some women choose not, or I would say most women choose not to have injections, and it works great without injections.
Wow,
so, yeah.
So cool.
Yeah.
So how much of your business over at Austin Integrative Spine is the Aqua Method versus some of these just, kind of other menu items?
Yeah, so
I would say,
I would say our Aqua Method is probably 50% of, or maybe not 50%, maybe 25. And then the other 75% is a mixture of treating brain and spine disease with other things that are more severe brain and spine disease. We have proprietary protocols for treating those things, and then a small amount of cosmetic and sexual rejuvenation.
Okay, and in terms of the brain injuries and things like that, what do you employ there?
So
and for what kind of condition?
Yeah, so with Dr. Ovokaitis' technology, we've had it for a couple of years, and we found a couple of sweet spots in terms of neurologic disease. I get a lot of questions about a lot of rare and unusual diseases, and we've treated a lot of different things. And I would say, I'm going to talk about the sweet spots, and then if you have any other thing that you might want to consider, just call us, and we can even do a free 15-minute consultation with one of our team members to see if that particular thing might be a good fit. The sweet spots that we have found are recovering a head injury from mild all the way to severe, from recent all the way back as more than 10 years ago, both adult and pediatric. And then also we have protocols for spinal cord injury and spinal cord disease, autoimmune spinal cord disease. Again, these are complex medical issues, and so we go through a lengthy intake process to make sure that it's a good fit. But we do have proprietary protocols for a lot of neurologic issues.
That's cool, because people ask me about TBIs a lot.
Yes.
And my answer is because so many people have them, and I don't think many people are aware of how detrimental they can be to your quality of life. And I'm always just like, do a bunch of hyperbaric.
Totally, totally.
That's my only answer, because I haven't met anyone until this moment that has another
I can tell
solution.
you this, when we started with the traumatic brain injury, I knew this technology was going to be good. I didn't know how good it was going to be. It's really good for traumatic brain injury. And I'm at an early phase of figuring out the optimal protocol, how many treatments. This is not a one treatment and you're perfect. It's usually a multi-treatment process, but it's definitely impressive.
Awesome. What about things like Parkinson's, MS, Lou Gehrig's?
Great question. So the reason that I talk about the sweet spots, or I shouldn't say the reason, what I think is the reason that these things I mentioned already are the sweet spots, are that those are pathologies or problems where the insult has already happened. There's an insult a year ago, a week ago, 10 years ago, and then the brain is recovering over time slowly, or maybe it's plateaued, but the insult already happened. In neurodegenerative disease or progressive disease that keeps that neurodegeneration is happening, it's not the insult back here, it keeps insulting and insulting and insulting. We have had some success with a couple of specific neurodegenerative issues when they're treated very, very early and multiple treatments, but it's not like a cure or reversal, it's like a maintenance. Situation. So it is doable, but it's a very different thing when you have an ongoing disease process.
Okay, cool.
Yeah.
Did I forget? Oh, I know what I want to ask you. I'm like, did I forget anything? Yes, I look at my notes. What's this WAVI scan?
Oh, yeah. So WAVI is
I just picked up some things from the website that I didn't get when I was working with you. And I'm like, what there's things I didn't know
WAVI is really cool. So WAVI is a non-invasive brain test. It's an EEG, but you can do it in the office to test for your brain function, and you do it wide awake, no pain. We wear this little cap, and there's some interactive tasks that you do with a computer, and it's able to measure the brain reaction time to different tasks. And we've seen changes pre and post our treatments with our patients with brain disease, for example, or with the traumatic brain injury, where we test them before we do treatment, and then we test them after, and we see an improvement.
I love that.
Cool. It's a diagnostic.
I love when you can quantify
Yes.
something,
Yes.
like, I don't know, I'm just a geek. I mean, I think everyone wants to know if something's working, right? And you sometimes subjectively think, I think I feel better, but I like things like that you can like look at your test results, do the thing, look at the results again, even lab work and stuff. It's just fun. Like, I tested high for heavy metals and I went and did a detox and now they're lower. It's like, yes. Yeah. It's a good incentive.
Confirmation, totally.
Yeah. And then what about the oxidative stress analysis?
Oh, yeah, we need to take that off the website.
Okay, you don't do that?
Not anymore.
I'm going to pull out all the things that
we need to update it. It was something we were doing as part of our functional medicine workup, and we actually switched platforms. So we actually have a different functional medicine lab panel that Katie Volkers, my nurse practitioner, is the lead on.
Oh, cool.
And it's a different, that is part of it, kind of, but it's not that exact thing anymore.
Okay, and are you guys working with NAD?
So great question. It's funny, you're the second person to ask me that today. We have access to it, we can get it, and we do it occasionally. My impression when we were using it with patients was I was not getting the bang for the buck that I wanted in terms of a treatment. My clinic is mostly treating people with stuff that they want fixed, and our protocols with our laser plasma and our biologics are so strong and good, and they work well, that I couldn't tell the difference whether somebody got better with NAD versus without. It doesn't mean it's not great for anti-aging and general wellness. It's just for the way that I do my practice now, I don't know that I need it. Does that make sense?
It makes sense. I mean, you're doing some next level stuff that I think is, above and beyond. And like with something like working with NAD, I mean, you can go to Alive and Well. And
totally.
I mean, it's not like you need to go to see a neurosurgeon to get an NAD.
Exactly. And it's also about like how we use our resources in our clinic, right? Like what my people, what are the things that we're going to be taking advantage of their skills and expertise for.
Yeah, I just want to ask you, because you might have said something like, oh yeah, you didn't know NAD does this, this, and this. I'm like, okay, cool. As long as I'm not missing anything.
No. I love NAD. Okay. I love it. Yeah. I'm a big fan. We just didn't see for our procedures, did we need it or not? We didn't.
Yeah.
We don't do it.
Cool. Yeah, I recently, oh God, I hate it when I find a great brand. Ion Biome. I'll put it in the show notes, you guys, at lukestorey.com/Aqua Method. But I recently, a company reached out to me, and they do this transdermal NAD.
Love that idea.
It's so cool. There's it's basically like a little electrical plus and minus sticker, and then you mix up the NAD and you pour it on the plus side or the minus side, whatever it is, and then there's some saline and you put this.
If that works, I'm in, because the IV, personally, I was, this is horrible. It's not worth it. Yeah. I did not like it, even with the stuff before.
Biome. I feel so bad when I can't remember these things, but I get so many things. It's hard for me to keep up with the names. But it gives you a lot of energy.
Awesome.
It's incredible. Yeah.
Awesome. Well, maybe I'll check it out.
It lasts 12 hours or something, you know. And then John Laurence makes NAD suppositories, which are great too. Yes. NAD I find most useful for flying.
Oh,
that's like my silver bullet. Yeah. If I'm going to fly, put on one of those patches or do the Mitozen suppository, and it's like, I mean, I don't know how to quantify it, but I would say maybe 50% less trashed from jet lag and just travel.
Well, I would say my thing for that is the guided visualization from Dr. Morgulin, Energy for Success.
Really?
That ever since I started doing that years ago, very, very little jet lag, and doing it twice a day. That's one of the gifts for the audience.
Oh, cool.
Did we say that already?
Yeah, I did. Yeah.
Okay.
I'm going to put it. I
you'll
gave
put it
the
in
link
the notes.
energyforsuccess.com/Luke, but I'll also just link it in the show notes for this episode too.
Awesome, because that is part of our treatments for our patients, and it's also my key, my one personal biohack that works for me every time.
So are you doing the visualizations like on the plane or just
Yes,
when you,
on the plane. If I'm like, sometimes when I'm on a plane, I know that I'm tired and I want to sleep, but my body won't sleep. So I'll do it, and I will feel as if I had that nap that I think I needed. So I'll do it on the plane. I'll do it the morning if I get up, and then in the evening as well.
Amazing. Yeah. Well, a lot of it is energetic and mental too. You know, I know if like sometimes when I'm flying, I'll listen to my new Calm neuroacoustic tracks and just like just drool out for 90 minutes. And I'm like, holy shit, I land. I feel pretty good.
Yeah, exactly.
Combining like something that gets your mind in the right state with some NAD, it's a recipe for success. All right. Well, I think I covered everything I wanted to discuss with you.
Cool.
I want to just thank you for creating something so amazing. I want to thank you for being a medical professional that had the courage to step outside the box and to open your mind and think about ways that you can help people in a more holistic and comprehensive fashion, really truly bringing the mind, body, spirit element into your practice and what you do. And I just am stoked to have met you. And I'm stoked that I feel so good in my body that I can sit here like this, I mean, after a while, like my foot will go to sleep and then I move. But I'm telling you, like a couple months ago, I'd sit like this, like, my hip hurts, and it just doesn't hurt, which is
and you've been through such a long time with that hip. So is it okay if I share one goal about the Aqua Method of what my vision? I was thinking about what I wanted to share with you today, and that key environment that we're building with that special space and that special healing. When we do these intensives, we can do up to 5 clients in a week. And right now, that destination is located in either DFW, Dallas-Fort Worth, or in Austin. We're kind of going back and forth between the two. But ultimately, I think this has a huge potential for being a retreat for like-minded folks who really want to go, and people that have like a shared vision or a shared goal. I've imagined groups of people coming and like wanting to collectively heal together. So that's my long-term vision, and I wanted to share that with the audience so that if you have a group and you're interested, let us know.
I love that.
And then destination, getting to do it in different places would be amazing too if we can get all the logistics worked out.
Cool. I mean, again, going back to the Dispenza thing, I don't know why I keep bringing him up, but I mean, I think a lot of the healing that takes place in his intensives is just because of the collective consciousness of that many people in a room who have, the nuanced objectives, but the intention overall is the coherence and the healing. I think that's a great idea. I can imagine like a Aqua Method retreat, right? Where you have a group of 20 people that come in and this, not only like, because you have a great team as we've talked about, but imagine like if I'm going back a month ago and I'm going in there and I have 5 of my friends and we're all kind of in this together and holding each other accountable to do our exercises afterward. Are you doing your intentions? Are you doing the mantras? It's like, I'm kind of on my own and I come home and my wife supports me. But like if I was sequestered away for a period of time and going through that with some other like-minded people, that's a really powerful idea. Yeah. So for people right now that wanted to come experience that, they would come to Austin or Dallas?
Right now, I'm in the process of opening an office in Dallas.
Oh, okay.
And so this particular upcoming session in August, which I don't know when this will air.
Probably after August. Yeah,
okay.
Usually they're like 6 to 8 weeks after the recording.
Okay, so the next one upcoming in 2023 will be in DFW. The one after that will be probably 2 months later, and it probably will be in DFW, but it might be in Austin. We haven't decided yet. So,
okay, cool.
And part of it has to do with the clients that we get and they're interested and where they're coming from, and some logistical things that I'm working on in the other office.
Okay, cool.
But it'll happen.
Awesome. Yeah, I really, I'm digging your vision though.
Yeah.
I mean, plus you could go, I don't know how practical it is to take your medical staff and all the accoutrement of the equipment and all the things, but it'd be rad to go somewhere beautiful and
that's the goal.
Have a retreat. Let's go to Mexico.
That's what we need is if we have a group committed to doing it, then we can make it happen.
Then it becomes feasible to do that. Yeah, that would be rad.
Yeah.
Because even just doing it here in Austin, I mean, like I said earlier, I had this deep emotional healing take place, even though I'm like in a medical clinical
Right.
office, which
Right.
is, it's not really associated with that kind of work. Usually that's in like a meditation room,
Right.
or something
Right.
like that. But I still had that kind of experience. But I imagine like if I was able to, instead of walking out of that clinic to a parking lot in a medical, mini mall or whatever, it's not a mini mall, whatever you call it.
Yeah, office building.
Office building, medical office building. If I walked out and was like, cool, I'm going to walk down to the beach and do my mantras,
Yeah,
it'd be pretty rad.
that would be pretty rad. That's the vision.
I'm going to hold that vision.
We're creating the future.
Cool, awesome, I love it. Well, thank you so much for coming by. I'm glad we got to sit down and take our time and really unpack all your work.
Me too. Thank you so much.
I appreciate it. Yeah, thank you.
Take care.